I appreciate the opportunity. Tonight I'll join my comments along with the first presentation. But before I start the presentation regarding our return to school planning for January, I want to take a moment to thank the incredible staff of the Cherry Creek School District. Our administrators, teachers, paraeducators, food nutrition workers, bus drivers, and classified staff. Over 9,000 strong. They rose to the challenge during this unprecedented time. Opening an online school for over 10,000 students that needed to make that choice in a month, and returning over 45,000 students to in-person learning for over 11 weeks. And I know it's not easier for anyone, but the incredible effort our staff put into moving to remote deserves recognition. So to all of our staff, thank you. I appreciate every single one of you and the work you do for our kids. I also want to thank our parents and students. It's been a difficult time and an incredibly hard year. I appreciate your patience and understanding as we navigate these unprecedented times, and truly do believe we have been a leader in this work. But I want to thank you because it's been difficult for all of us as we work through this together. As a learning organization, it is critical that we use updated science, data, and facts based on ours and the world's experience since this August to update our plans to move forward. We cannot ignore new information and continue to operate off of what are now outdated understandings of the virus in schools. My goal is to return to in-person learners to the classroom starting second semester and throughout the remainder of the year, and will offer additional mitigation strategies to help support our successful return. Even with these strategies, however, there are limits to what is operationally possible. The spread of the virus must be kept under control. And so I will start the presentation, updating the Board of Education on our plans to return this coming January. We'll start tonight just with a very brief review of first semester, some data from first semester that informs our decision-making, new learning from reviewing our data and those data from around the state and the world, updated health guidance from the Metro Denver Partnership for Health, and then finally, the return to school plan for January 2021. So first, a review of first semester. We truly led the way with a data-based decision-making. We identified a number of different areas to follow to kind of rate the virus and its spread in our community as a way to make a decision about whether to be remote or in person for the 45,000 students that chose that learning mode. We continued to utilize that until we went remote just recently. We also in first semester, as you know, opened up a full remote option for many students and families that needed to make that choice for their families during this time, and an in-person option with health guidance. In the first semester, we had 11 weeks in person and 4 weeks remote. I can remember as we announced that we were opening in person, hearing from many they thought we'd be lucky to make it to Labor Day. And we made it a significant amount of time before the data just truly did get out of control. And to make it that long, I am, again, proud of our staff, our students, our parents, and our community for doing such a great job. So some of the data from first semester. And as I said before, we remain committed to data-based decision-making, and therefore it is critical to collect, analyze, and utilize new data to update plans that we created 6 months ago, where we had a very different understanding of the virus at that time and had no understanding of the impact of the virus on schools. And so we continue to look at it, and that's why it's important to share and to utilize. I also want to point out that the work we'll do tonight and what I'll share is in alignment with prior agreements. Board of Education passed a resolution in August, as Ms. Fisher said, supporting the process. And you can see here, they support any revisions required based on available science and data, and I look forward to your questions and feedback tonight after hearing it. And with CCEA, our Teachers Association, support the idea of using measures to track the progress of COVID in our community to make decisions about how we move forward. So knowing that, some of the data we collected. Now our community, and you have seen this before, this is a chart that shows, in the gray bars, the daily COVID cases in Arapahoe County, 7-day average. The green numbers on top of those represent the incident rate at the moment in time. The blue bars represent the number of students and staff in Cherry Creek School District that were quarantined. And the red line are the number of students and staff that were COVID positive at that time. Now, again, this is all 7-day average, so it's smoothed so that we can see trends as opposed to individual up and down certain days. We started school back in August. You can see for a long time, we had great success. In October, we received the ability from CDPHE to start targeted quarantine, and that helped us to make it even further as cases started to increase. Then I marked this date, October 28th, as the first day our Cherry Creek metric turned to red. And then finally, the last day I mark is where it became very difficult for the Cherry Creek School District to continue operating because of the extreme number of positive cases and the number of students and staff in quarantine. And so somewhere in between that first day in red, marked at 10/28, and that day where we had to go remote, we were able to operate in there for a time being. And so we're hopeful that looking at that range of incident rate from 314 to nearly 600, that we can identify that as a range that with additional mitigation strategies can continue to be very successful in our future. For our community, as total numbers to date, we have 620 students and 352 staff that have tested COVID positive. And I think these numbers were updated last week. We have 3,927 students and 553 staff that were quarantined due to potential close contact, and a number of students and staff that were placed operationally remote simply because we had to turn an entire grade level or school or group of students to remote because we didn't have enough staff to continue to support their in-person learning. What's most interesting, however, is that we look at these numbers of students and staff that were put in quarantine because of close contact. We're able to track that of those, we know that 16 students and 10 staff members became knowingly COVID positive during their quarantine. So again, these individuals were put in quarantine because of being in close contact in school. And then this extraordinarily small percentage became COVID positive during quarantine. That starts to paint the picture that the multiple overlapping safety strategies that we've implemented in schools do work and have limited the spread in schools. So there are COVID positive people that come into schools, but we can now show data that says that it's not spread in schools. We have similar data from a group of school districts in Colorado. I led a project of 35 districts that we started to collect and aggregate our data so that we could look, is this just a phenomenon of one district, or can we see this over a number of different districts? So of these 35 school districts, as of November 28th, 41,026 students were put into quarantine because of close contact, and 166 students became knowingly COVID positive. Same percentage as we had for Cherry Creek at 0.41%. And 7,602 staff quarantined, and 144 became COVID positive, 1.89%. The numbers reflect almost too closely the numbers specifically to Cherry Creek, but again, these are 35 distinct and disparate school districts putting in their own data, and it becomes aggregated. Now, I do want to acknowledge, and it's written below the chart here, there is a limitation to this. These are individuals that we know became COVID positive because they became sick and got tested. What I cannot tell you is if there were asymptomatic positives that came from those quarantines. That's the same problem we have across the entire world. We can't track that asymptomatic piece. I do look forward to sharing some data tonight, some information tonight, where we can in Cherry Creek start to track that and know for sure, but it's still an extraordinarily small percentage of both students and staff that became knowingly COVID positive during quarantine. Same information, just charted. The blue bars represent the COVID positive numbers for the state of Colorado aggregated by weeks. You can see how they grow throughout the first semester. The orange line, the number of students and staff that were put in quarantine from the data I just shared with you. And the red line are the number of individuals that became COVID positive. You can track the specific numbers down below. Well, what this graph starts to show is even though there are very few students that catch COVID from being in school or close contact in school, there are a significant number of individuals that were put in quarantine. And that's why all school districts had to move remote eventually, because we could not keep up with the significant impact of the number of positive COVID cases coming from the community into school. Finally, looking specifically at Cherry Creek and looking at our cases of students by level, to date, we've had 7 students in early childhood present as COVID positive, 164 in elementary, 116 in middle, and 330 in high school. However, it's more important to look at the percent of population, because you can't compare 164 elementary students to 116 middle school students. It's a bigger number. You have to realize that in elementary school, we have 6 grade levels of students, and in middle school, we only have 3 grade levels of students. So the percent of the population follows exactly what we know and we hear about in the literature, that younger students catch and spread at lower rates than older students. And this is our data as it's been presented from cases over the first semester. Second piece of data is just tracking our staff members in Cherry Creek School District. So on the left, 127 staff members tested COVID positive during the first 3 months of the school year while we were in person. 234 staff members to date have tested COVID positive during the last 1 month of being in remote learning. So we have a significant increase in the number of staff testing positive after going remote, as opposed to the 3 months spent in person. So some of the conclusions that we can start to draw from this data. First, what we thought to be measures of school safety in July are much better identified as measures of operational viability. How long can we last with significant quarantines or impact on school operations? And I can say that because we can demonstrate in schools that have universally implemented the recommended multiple overlapping safety strategies that COVID is not spread to any meaningful degree. Schools are safe from the spread of COVID. It becomes an operational question of how long we can continue with a high incident rate in the community. And based on our collective experience and with the support of the MDPH, we really can start to narrow in on the incidence rate as the best measure of the impact the community spread will have on our schools. So as you remember, the first slide, I shared 6 data points we were tracking. Really, this data point from our experience becomes the most meaningful as we move forward. And finally, our data and experience demonstrate that at or above some point above a community incident rate of approximately 500 per 100,000, it becomes increasingly difficult for schools to maintain in-person learning. That's about the point where the wheels started to fall off the bus a little bit. I believe that with some of the additional mitigation strategies I'll share tonight, we could make it higher than that. But that's a point where we can point to pretty universally across the metro area that it became much more difficult to maintain our operations. So with these new conclusions that we've drawn from our data, and as a learning organization commit to continuing our learning and growth and evolving based on updated information, we then look to the health guidance. And we received updated health guidance from the Metro Denver Partnership for Health. And as a reminder, this is a group of executives of the health departments from Boulder County Health, Broomfield Health, Denver Public Health and Environment, Denver Public Health, Jefferson County Health, Tri-County Health, and the Colorado Health Institute. So these individuals come together in partnership to provide guidance and support pre-pandemic and certainly have through the pandemic. So their updated guidance, as you can see, will come out, it's on December 14th. It'll be on their website. You can see listed down there below. And I'll highlight a few of the specific items that they placed in this new guidance that align with some of the information I've just shared with you. And so again, this is health experts guidance provided to us. So an updated review of the scientific literature from them. First, young children appear to be less susceptible to COVID-19. They catch it less, they spread it less. It's not that they don't get sick, they certainly can, but they catch it less and they spread it less. Second, schools can prevent transmission even when community rates are high. Here it says a greater than 175 per 100,000 incidence rate. Absolutely. I just shared with you that we started to hit us hardest at about 500. So due to all the safety strategies, the distancing, the masks, the increased ventilation, everything we put in place, we can prevent transmission in schools even when the rates are high outside of schools. Third, schools are clearly affected by community transmission. As I've just said, somewhere above 500, it becomes nearly impossible to operate. Don't know exactly what that number is, but it becomes definitely difficult to continue as those cases in the community rise, and we are affected by that. And that's why we work so hard and ask so many times, as many board members did tonight, to get our community to lower that incidence rate. And finally, schools are not the primary drivers of community transmission. Again, COVID comes into schools, but it's not spread in schools. So this is from the health experts, and based on this, they provide recommendations for returning to and maintaining in-person attendance during the second half of this year. First, just a clear statement, we all believe it. In-person learning is the best place for kids to be. Many board members have said it, our community says it, I believe it, we all believe that. It's how do we mitigate the ability to continue operating. Some of their advice is to start with the youngest children, start with elementary school, and then stagger middle schools and then high schools. You've seen some of our neighboring districts have put out plans where they will stagger that start over a number of weeks. Schools must continue to comply with all the prevention measures we put in place, from distancing to mask to ventilation. That can't change. I can share success because we've implemented these strategies, and so it's not the time to do away with them. Targeted quarantine, implement strategies to decrease school disruption. So now with new updated guidance from CDC, students and teachers can test out of quarantine after their 5th day with a negative test, and the quarantine timeline can be reduced. That allows students to come back to school sooner and earlier, and allows teachers to come back to teaching, and allows everybody potentially out of a quarantine a week earlier. Next, consider expanded testing for COVID-19 among asymptomatic students and staff and persons in quarantine. So we will talk in a little bit here about how we are going to expand testing opportunities in alignment with this recommendation. So we can test asymptomatic students and start to create that bubble around our schools to keep them safer and operationally longer. And then those individuals that are put in quarantine, offer free testing to them so that we can supplement our data and our strategies and get people back to school sooner. They also suggest that we continue to collect additional data, such as the rates of inter-school transmission through the testing I just mentioned, positivity rates for staff and students over time, and the percentage of staff and students who undergo routine surveillance testing, so that we can inform health department recommendations moving through the second semester. They also suggest here delaying the relaxation of any community mitigation measures until K-12 schools have been reopened for in-person learning. Prioritize schools over everything else. And then the last part here, in alignment with Ms. Fisher's comments, consider prioritizing elementary school staff when COVID vaccine become available for essential workers, priority 2A in the state plan. So those are the recommendations from the Metro Denver Partnership for Health, again, the group that we take guidance from as we make our plans. So given what we know and we have learned and the data we've collected in Cherry Creek, along with the health guidance, our return to school planning puts all of that together. Our goal clearly is to return in-person learners to the classroom moving forward. But to achieve that goal, as a community, we must achieve a lower incident rate to successfully operate schools. Both of these things need to happen. So as I put it together, metric for operational viability. Talking about what we thought of measures of school safety in July are truly better measures of operational viability. Talk about the spread of COVID. I also talk here about the advocacy to have educators prioritized appropriately in the right place to receive a vaccination, and then measures of operational capacity that somewhere over 500, it starts to become increasingly difficult for schools to maintain in-person learning. So at the bottom here, I have taken a picture of the state's DIAL framework, specifically for incidence rate, not positivity, not hospitalizations, only incidence rate, and then put in the categories what the different ratings are, thresholds are for green, blue, yellow, orange, red, and then purple, as we know, is when hospital capacity has been breached. So using that as our measure, our metric moving forward, we look then at, as I've mentioned, the incidence rate, today at 891. Again, that's the point where we need to get that closer to 500 to make operations much more viable long-term in the second semester. And that's work now that we have 4 weeks ahead of us that we can certainly do as a community. And the last number of days, it is absolutely moving in the right direction. The educator vaccination, as was shared, we strongly advocate for educators to be prioritized in the vaccination schedule. Again, in the appropriate place at the top of phase 2. And this plan, as Ms. Fisher says, remains in place until educators have the opportunity to receive a vaccination. I cannot compel, I cannot require, I will not track who does and who doesn't. But once their opportunity exists, schools will be in person moving forward because educators, frontline educators will have had the opportunity to protect themselves through a vaccination. So that is a significant statement of the opportunity to not only get kids back in and keep them in, but to get our economy moving. So looking specifically by level then, what does this mean for elementary students in elementary schools? You can see the metric by the different levels of the state dial in person through orange. Level red, where we do live now, is in person or remote, and the level purple would be remote. If hospital capacity is breached and there are no more ways we can help people that need help in a hospital, it does not make sense to have people in schools. And so that will be clearly remote if that decision is ever made by the health department to move to purple. If we are in red, we will make a decision to be in person or remote based on the operational capacity of the organization and individual schools. So the model of schooling, as it has been all first semester, 100% of in-person learners, 5 days per week. The additional mitigation strategies above health guidance that are already universally implemented. So that's mask, ventilation, physical distancing, all the things we already have in place. We are going to add no cost ongoing testing of students and staff at elementary school sites to allow for early identification of COVID positive children and adults who could also be asymptomatic, creating a safer, more operationally feasible environment. So we'll ask elementary parents to bring their students, and elementary staff, we will bring testing, saliva-based testing, to our elementary schools. It's, again, not something I can require or compel any student or adult to do. I will ask our community to work with us to help create bubbles around our elementary schools, so there is no question of their ability to continue operating. And so on a regular schedule, students through saliva tests and staff through saliva tests, we can maintain our schools in person if we all commit to helping with a solution. Second part, we will provide free PCR testing to any student and staff that has been placed in quarantine. We will offer that on day 5 or after from exposure, and with a negative test, any of those individuals can exit quarantine on day 7 and return to school. So I believe with the additional mitigation strategies of testing, that we can keep our schools in person at higher incidence levels than even we were able to in November, because we can create a bubble around those environments through those asymptomatic tests. A little bit more about the testing for students. I believe it's truly a pathway to opening, and keeping elementary schools open through vaccination is truly that testing pathway. So we'll provide it free. We'll offer free testing to those students through COVID Check Colorado at our school sites. It is a saliva test with a quick turnaround. Students that test and staff that test in the morning may know before they have dinner that night. And so that will really help us to maintain that safer environment. Again, as I said, I can't compel students or staff to test. It truly is about a commitment to the greater good and keeping schools in operation. Active permission from parents is necessary. We'll absolutely won't test anybody without parents being in full control of that situation. And we'll start on January 5th, 2021 for students and staff. And that date will make a little more sense as I get to the opening plan or the opening dates at the end of this presentation. Then the secondary schools. So you can see the different levels: in person, hybrid or remote, and again at level purple, fully remote. The model, as we know, 50% of in-person learners, 4 days per week, 1 day remote. We did provide to our community an updated hybrid plan that is a reflection of the survey from the community and from direct conversations I had with student representatives at all of our high schools. Additional mitigation strategies at high school. We will use updated guidance from the CDC, again, to allow people after day 5 to test out of quarantine. That will get teachers back in the classroom sooner and students back in the classroom sooner, and really lessens the impact of additional quarantines. We will also most readily at the high school and middle school use targeted quarantine strategies to minimize the disruption. That means that if there's a COVID positive individual in a classroom, we can literally draw a 6-foot bubble around where that student or that staff member was, and only quarantine the individuals within that 6 feet. It doesn't work as well at the elementary school because kids are together for a full day every day, whereas as we know, middle school and high school, they change classrooms a couple of times. So we'll use that as a strategy to keep more teachers and students appropriately from quarantine, but we will always default, as we did first semester, to if it's close enough, then we will go ahead and quarantine. And the last piece, again, we will offer no-cost COVID tests to secondary students at our 2 drive-up facilities to allow for early identification of, again, COVID positive children who could also be asymptomatic. So our staff throughout this entire year has had access to free COVID tests. We are now expanding it to our elementary students at school, and our middle schools and high schoolers can sign up for tests. and come to our drive-up facilities at ISF out by Thunder Ridge Middle School and the Stellar Bowl parking lot by Cherry Creek High School, and really get those free tests, no cost, to continue to support the creation of that safest bubble environment around our schools so that they can maintain in person. So given that this will be our return to school days, if we look to January after winter break, January 4th is a staff furlough day, and so nobody is working or in school that day. On Tuesday the 5th, that is a staff work day. The 6th, 7th, and 8th, all students will maintain remote learning. And then on the 11th, in-person learning will begin. The rationale to start this way is with a 3-day week, it really allows post-holiday cases to present themselves and for those individuals to isolate or quarantine. So it gets us 1 week away from that New Year celebration so people can, again, have symptoms present themselves, test, isolate, and quarantine their family if needed. It also, as you can see on the 5th, 6th, 7th, and 8th, all of our testing will be open at our elementary schools in our neighborhoods and at our drive-up sites. So all students, any student and staff can come and test on the 5th, 6th, 7th, and 8th so that we can start on the 11th with a good understanding that we have an environment free of cases of COVID and asymptomatic cases and feel really positive about that first day on the 11th. So finally, how does the decision get made? So if on Monday, January 4th, the incidence rate for Arapahoe County is greater than 500 per 100,000, I will make and communicate a decision. What that also means is if it's less than 500, everybody is coming to school. If it's more than 500, I will look at a couple of things and make a decision and communicate whether we'll continue to open all schools for in-person learning on the 11th, or whether elementary school will open in person with the additional testing and secondary schools remain remote until a later time, a week, 2 weeks, 3 weeks, depending. Or third, all students remain 100% remote. And a couple things I'll look at. Of course, the incidence rate, as that will be our primary measure. It'll also be important to look at the directionality of cases. Are cases going up? Are they stable? Are they coming down? For example, today, at an incidence rate of 891, with cases coming down, I would be inclined to open all schools because the directionality of cases is in the right direction. We have testing for everybody, and the incidence rate is a lagging measure that will come down after it. If the incidence rate was at 700 and cases were going up, I might be inclined to make a different decision because the directionality of the cases would tell me where the incidence rate is going. And again, the incidence rate gives us an indication of whether and how long we'll be able to operate successfully in person. If number 2, secondary schools remain remote for a time being, again, my goal is at the time being. The kids get back into classrooms, and if it's another week or 2 weeks for us as a community to lower the incidence rate or to increase our testing, then we can take that additional time. Again, ultimately our goal is to get kids back in the classroom and to do it so that we can operate successfully moving forward.